Welcome. So maybe you're experiencing fatigue, diarrhea, constipation, bloating, brain fog, skin issues. This is a great test for you.
Today, we are going to dive into one of the most important functional tests that we use in order to identify and fix the root causes to restore long-term optimal health and vitality.
That test is a comprehensive stool test, and we're going to go ahead and share our screen with you so you can see what this looks like and how it may apply to you. Here we go. Let's make that larger for my old eyes. All right, Kimsey, what are we looking at here?
All right. So first, I want to do a brief overview to explain why a stool test is important, even if you don't necessarily have digestive issues, but especially if you do have digestive issues. So the intestines are basically one long skin tube that goes from one end down to the other. And it's the closest that the inside world comes in contact with our outside world. So because of that, about 70 to 80% of our immune system resides in the gut. In addition, we have basically an entire other organ system that we refer to as the microbiome. It's a collection of trillions of different bacteria. There's different fungi. We even have viruses there that are all supposed to be there. And they play a significant role in maintaining our overall health. However, through a multitude of different factors, stress, poor diet, nutrient deficiencies, for example, these bacteria can become imbalanced. And when they become imbalanced, in other words, there's too many bad and not enough good, something along those lines, when they become imbalanced, we have systemic ramifications. So that's where the connection between the gut and the rest of the body, and why it's estimated about 80% of disease arises in the intestines, is through what we're just about to look at. So let's dive in.
Okay, so what would somebody be looking at right here? Let's start with infection.
Perfect. So this test looks at the 4 pillars, if you will, of intestinal health. Moving from left to right, kind of in order of most important to least, is infection first, inflammation, insufficiency, then imbalance. So this first page is the interpretation at a glance, and then we'll dive into each of these more in depth. Infection refers to the presence of a microbe that is never supposed to be there. In this example, we see a parasite, a protozoan parasite called Blastocyst hominis, a very common parasite. So we'll talk about that in just a minute. The next pillar we have is inflammation. Inflammation, to define it, is simply the immune system's response to injury. So here, if we see inflammation active in the gut, it means that there's some kind of injury that the immune system is responding to. That could be food sensitivities, that could be gut dysbiosis, which we're going to talk about here. It could be infection, it could be stress, it could be many different things, but this gives us an idea of severity, and we often align that with your symptoms. Third section is insufficiency, and here we're looking at digestion and absorption. So how are you digesting and absorbing protein, fats, protein and fats largely, and we can get an idea of carbohydrates also. So here we're looking at hydrochloric acid production, stomach function, pancreatic enzymes, bile and gallbladder function, to give us more thorough idea of digestion and absorption. And then the fourth category is imbalance. So conversely to infection, I mentioned that infection represents a microbe that is never supposed to be there. Imbalance refers more to microbes that are supposed to be there, they're just in the wrong levels. So as I mentioned at the beginning of this talk, we can have too many of kind of less than optimal bugs, as we see here. The yeast is a big one. We can have too little of the good guys, or some variation in thereof. And we collectively refer to this as dysbiosis.
So, quick question, everybody's wondering, how do you get these infections?
Great question. So a few different ways, depending on what kind of infection it is. Some can be like Blastocyst hominis, for example. We see this come up a lot after multiple rounds of antibiotic use. There's some research suggesting this might be a commensal parasite. Commensal meaning it's supposed to be there. It's found in all of us, but it's a problem only when it overgrows. However, there's not conclusive research on that. So nonetheless, one of the factors that we do see pave the way for an infection such as blastocystis is when we don't have enough of the good bugs.
Right over here.
If we don't have enough good bacteria to help prime our immune system and maintain the appropriate gut environment, then these kinds of infections can overgrow.
It's very much like our ecosystem.
It really is.
Right?
Yeah.
It's exactly what it is. If you take away one thing, you're going to have an overabundance of the other. And the body balances itself out, or it can run rampant.
Exactly.
So I think it's a great way to think of it as like the ecosystem.
Yeah.
So let's move down here. Let's look at this diversity association. What does that indicate?
So diversity association and relative abundance, I'm going to give an analogy. You can think of the gut microbiome like a city. So both of these are reflective of the microbial diversity and quantity within the gut bacteria, those commensal bacteria. So if you think of it like a city, in a city, you want to have a lot of different kinds of people. So you have doctors, lawyers, janitors, mechanics, teachers. So all of our roles are fulfilled. You also don't want too many people, right? Because if we have too many people, then we have congestion, we have traffic. Same concept here. We want, in an ideal situation, we want a lot of diversity and an appropriate amount of people. Couple things that we see commonly are the flip of that. So we have low diversity
right here.
And this would be the equivalent of a city having only doctors and lawyers. Okay, well then who's going to teach our kids? Who's going to fix our cars? Who's going to clean and repair our buildings? There's different roles that go unfulfilled. And then in this test in particular, you notice that the patient results, looking at the bar graph, the patient results are far shorter than the healthy cohort. So in this particular example, we don't have enough. We don't have enough people in the city analogy. This case, we don't have enough good bacteria. So a lot of roles are going unfulfilled. And one system that really takes a hit with this is the immune system. So we'll also start to see systemic inflammatory issues, possibly low white blood cells, high white blood cells. We'll start to see issues arise in the entire body, not just within the gut. But nonetheless, the gut also takes a pretty big hit. So this person in particular was suffering from chronic constipation, really bad gas and bloating, and then also brain fog, sleep issues, weight gain.
All the things that we see.
All the things that we see all the time.
We see that we think might be our normal. Everybody experiences them.
Right.
And it's not.
It's not. And this shows us what we need to work on to really fix the root causes to restore long-term health, not just a quick fix solution.
Right. And this is breaking down then each of those, the overview at the top, which is so fascinating.
Exactly.
Right. This is so in depth. So let's look at your digestion and absorption, which refers back to the insufficiency.
Exactly.
Okay, so let's take it. So not bad.
Not bad, right?
Yeah.
Digestion absorption looks pretty good. Yeah. So one first marker that we want to look at is that first marker there called pancreatic elastase. This reflects our pancreatic enzyme output. So pancreatic enzymes help us digest our food, break it down into smaller and smaller subparticles so that it can be absorbed through the intestines, the small intestines. 500 or more is what we want to see. So pancreatic elastase in this person looks great. Next, you'll notice that pretty much all of those markers are within the green shaded area. So really and truly, what the assessment that we're taking from this is it doesn't seem to be directly a digestion absorption issue as the primary issue in this person that's leading to the constipation, that's leading to the bloating, etc. Okay, so digestion and absorption looks pretty good.
And if it wasn't, so for example, right, these fecal fats, if we were seeing them significantly elevated and they were popping up, what might that look like for an individual? Gallbladder,
right? So then
enzymes.
one of our founding mantras is ask why until you can't ask why anymore. So if we see elevated fecal fats, we start to ask questions. What does the gallbladder look like? Do we have blood work? Can we compare that to evaluate gallbladder? What is the person's history? Next, we might also look at small intestinal bacterial overgrowth. So this is a stool test. It reflects the health of the colon, but we can make some assimilations as to how the small intestines might be functioning. We'd cross-reference this with hydrochloric acid production, which points to products of protein breakdown, and then also pancreatic elastase, again, looking at pancreatic function. And then lastly, we can also start to uncover the rocks. Does this person have celiac disease, for example? Is there an underlying diagnosis that they're aware of, or possibly not? We can dig deeper into that too.
Okay, so let's look at your inflammation and immunology of this client.
Perfect. So inflammation and immunology, there's 3 different markers as you see here. They're listed in descending order of most severe down to least severe, most specific down to least specific. So calprotectin is a very reliable marker for indicating the potential for irritable bowel disease. Irritable bowel disease is different from irritable bowel syndrome. IBD refers to specifically either Crohn's or ulcerative colitis, an autoimmune condition occurring in the intestines. In this case, calprotectin is normal, so it's indicating this person most likely does not have those conditions. If I see calprotectin in the yellow or in the red, and this person's not coming in with a pre-existing diagnosis, I usually refer to a gastroenterologist just to have it ruled in or ruled out. Second marker is eosinophil protein X. Eosinophil protein X represents the eosinophilic activity in the gut. So eosinophils are a specific type of immune cell. If we see this marker elevated, first couple things that come to mind are histamine issues. So allergies, could be food allergy, could be an allergic response to a gut microbe, like a parasite, for example, which is the second category or second thought that comes to my mind too is, are we dealing with a parasite? Eosinophils, even globally speaking, even looking at the rest of the body, we can run eosinophils in blood. And when they come back elevated, those are 2 first things that come to mind. If we rule those out, then we can look at other factors, but first looking there, especially since we're looking at a stool test.
It looks great.
Yeah, EPX looks great here.
Same with your IgAs. So talk about that, because we hear a lot about IgAs, IgGs, IgE. It gets a little confusing.
It does. So fecal secretory IgA, I mentioned descending order down to the least specific. So fecal secretory IgA is an antibody, immunoglobulin A. We have 4 different antibodies, IgA, IgG, IgE, IgM. I apologize, 5, and IgD. IgA lined our mucosal linings. So we have the gut, we have the lungs. In women, we have the vaginal canal. We largely find a high population of IgA. These guys, you can think of them as the first line of defense. So if we eat a food we're sensitive to, if we're experiencing a lot of psychological or emotional stress, if we're eating a poor diet, if we have imbalances in the gut microbiome, this guy is going to be one of the first to respond. So that's why I say it's non-specific, because if it's elevated, we just see, okay, something's going on in the gut, something's triggering an immune response. Let's dig deeper to figure out what that is.
Right.
And oftentimes it's many different things, right? The person's experiencing a lot of emotional stress. They're eating a poor diet because of that. They have imbalances in the gut microbiome. So it's a lot of things that we'll work on. But I do want to say one thing I want to point out with secretory IgA is low isn't necessarily always better.
Great point.
Yeah.
Explain why.
Yeah.
Right? You want to have that perfect balance right in the middle of this one.
Too high tells us, it does say that your immune system's working, right? It shows there's an immune presence. It's doing its job. We need to figure out the trigger and help remove it so the immune system can be more effective, but it shows it's working. too low. And what I mean by too low, this person looks great, well within that range.
Mm-hmm.
When I see below detectable limits on this test, and that'll come back fairly often, less than DL sign, below detectable limit, that tells me not that there's no inflammation. It tells me the immune system's losing the battle.
Right.
There needs to be some kind of a response. And so usually what I'll see is the person's been having this problem for a long time, and there's often fairly significant issues that accompany it. So we see pretty significant overgrowth, pretty significant infection. And we'll often see that pass over into the rest of the body too. So if we run blood work, there might be low white blood cells. There might be something that's showing up systemically, not just in the gut.
Okay, let's look at this microbiome, because this is something that did come up.
Yes. All right, so looking at the microbiome, this is where we start to get into that commensal microbiome. So each individual bacteria and their byproducts. So what I mean by byproducts, what we're seeing here, metabolic. So just like you and I go to the bathroom after we eat, so do these microbes, and this is what they eliminate. We refer to this as products of fermentation or short chain fatty acids, which are products of fermentation. And there's a lot of research going into what these different short chain fatty acids do. I'm going to speak to a couple of the more important ones. So butyrate is the ideal fuel source for colon cells. So let's talk about why that's important. Our colon is exposed to a lot of abrasion, right? We're eating foods, there's fibers, there's byproducts, there's a lot of different things that are constantly creating an abrasion to the gut lining. Because of that, think of it like our skin, right? Coming in contact with things all the time. Because of that, those cells reproduce at a very fast rate. You, conceptually speaking, almost have an entirely new intestinal tract every 7 to 10 days because those cells are turning over so fast. So you can deduce that requires a lot of fuel. Butyrate provides that fuel. So we want a robust amount of butyrate to support healthy cellular turnover, which means we have a healthy intestinal lining. Low butyrate contributes to not a healthy turnover, compromised intestinal lining, and we can deduce more than likely, since it's a product of bacterial fermentation, probably not enough good bugs, the bugs that are producing butyrate, which are our good important bacteria, and we'll see that in just a minute. Acetate and propionate, as you see here, this person's acetate was just barely high, just 0.7 above the limit. I really look at these rather than looking at them as individuals and chasing those individual markers. When I see dysfunction or imbalances in this particular section, it's more of a downstream problem. So I'm not thinking, oh, I need to fix this person's acetate. I'm thinking I need to fix this person's microbiome. And then the acetate and the butyrate and the beta-glucuronidase, those will come back. They figure themselves out. Yeah, they work themselves out.
It's like a large family.
Yeah.
And they're all trying to get along. Right?
Yeah.
So you do the work.
Exactly.
In the big picture.
Yeah. It is worth mentioning beta-glucuronidase. Because this one is, it's creeping up there. It's right at the top end of the limit. Beta-glucuronidase is an enzyme. So in one of the phases of of detoxification, the liver binds a protein called calcium D-glucarate to a toxin. I don't want to get too techie and lose you guys, so I'm going to keep this simple. Binds it to a toxin, we eliminate that toxin into the gut, and then normally we're supposed to eliminate it in the stool. Some of these, quote, toxins, things like hormones, for example, cholesterol, we might want to recycle. We actually want to absorb them, reabsorb them, recycle them, in other words. So beta-glucuronidase helps us do that. It's an enzyme that cleaves that calcium D-glucarate and, quote, toxin bond, and allows that, quote, toxin again, in this case, it might be a hormone, it might be cholesterol, something we want to reabsorb, allows it to be healthfully reabsorbed. However, when beta-glucuronidase is elevated, we're going to start reabsorbing too many toxins. So that would be like taking out the trash, looking in the dumpster, seeing that it's full, and saying, that's okay, I'll throw it in my living room instead. Not
So
very sustainable.
This is a complex one.
Yeah.
So what does it look like for the patient?
Good question. I'm really glad you brought it back to that.
So they've got a bunch of trash in their living room. How does that feel?
It feels like hormone imbalance. It feels like bloating. It feels like water retention, fogginess, heavy, tired, inability to lose weight. That's what we're looking at when we see this.
Like,
it's a
so
toxic
it feels like many of us.
Feels like you're toxic.
Yeah.
Yeah, exactly.
So that's an important one.
It's an important one.
We dump the trash. Don't put it back in your living room.
Yep, exactly.
Okay, so this one, I don't know that we want to go over everything other than give an overview of what you might see or what this means.
Yep. We're going to give this one a quick overview and then get into the next factor of it too, which looks at more of overgrowth. So here, this is a reflection. If you guys remember the bar graphs that we saw on the first page and the diversity association, this breaks those down. So we're seeing deeper into each individual bacterial phylum to see how robust the microbiome is. So I'll be honest, I don't look at each individual bacteria. I look for trends, and then I cross-reference that with some of the more important guys. So the trends here, like what we saw on that first page, is they're generally low. Anything that you see on the far end of this graph or touching a gray shaded box shows that it's either low or below detectable limits. And one thing that I do want to point out here is that the lactobacillus right here and the bifidobacteria right here. So these are supposed to be the most abundant bacteria. These we collectively refer to as probiotics, right? They help us with so many things. They help us with digestion so we don't feel bloated. We don't feel constipated. We don't have diarrhea. They help us with our immune system so we don't get sick. They do a lot for us. If you notice here, both of these are below detectable limit. So that's a big reason as to why this person not only has the overgrowths like the yeast and the blastocystis, but more importantly, the chronic constipation because we don't have the support here. Okay.
All right, let's take a look. Now let's break this down into that culture because it did come up positive with yeast.
It did.
Okay.
So here, mycology. A lot of you listening may have heard of something referred to as candidiasis or candida overgrowth or yeast overgrowth. It's very common. It's being even a lot of doctors are starting to look into this more. So let's talk about candida. Candida is what we refer to as a commensal yeast. It is supposed to live in our gut microbiome, right? It's supposed to be kept in check though by our good bacteria, the lactobacillus and the bifido and many others. If it's not kept in check and it's allowed to overgrow, we have a problem. One thing that you can think of that'll probably really hit home, in alcohol production, we use yeast to ferment sugars to create alcohol. When this is happening in your gut, that's a problem.
Look at us, we get so excited
I know
about
we
this.
do.
This
It's so much fun. It really is.
You will feel so much better
Yeah.
when we can take care of this.
Seriously. So what we're seeing here, that's why candida overgrowths affect the entire body. They create toxic byproducts that we have to absorb because it's in our gut. So it taxes the liver. It taxes our skin as those toxins try to come out. It taxes our hormone system. It taxes our immune system, our nervous system. So what does this mean for you?
We see a lot with the brain health.
A lot with brain health.
Yes.
So brain fog, anxiety, insomnia, depression, poor low energy, weight issues, can't lose weight, constantly gaining weight, skin outbreaks, acne. All of these things are what we will definitely, somebody experiencing yeast overgrowth can possibly experience. So we want to, this is one where I would see this and say, this is a root issue. We need to get in and eliminate the yeast, then build up the healthy bacteria, build up the gut immune system so that the bacteria at that point can keep the yeast at bay, and we have optimal functioning at that point.
Again, going back to that ecosystem, right? Everybody has to be within their boundaries, and they all live together.
Yep.
Until somebody decides to take over.
Exactly.
All right.
Okay.
There's your parasite.
And then last but not least, this just simply confirms what we saw on the first page. The fact that Blastocystis hominis, as I mentioned before, is a protozoan parasite. Protozoan meaning it's microscopic. This is not a worm. So don't freak out to that point. But nonetheless, you'll see here that it says many. That means that there's a pretty significant overgrowth going on here. The range is few to moderate to many. So there's a pretty significant infection. Again, just like I said with the yeast, this represents a root cause. So this is something that we would want to go in and actively work to eliminate and then restore the gut microbiome so that you have optimal long-term functioning.
And it'll even break down some of the other parasites that we commonly see right down here, and neuronegative for all of those.
Yep, that's great.
Okay. Just talks about the consistency, the look of the stool.
Self-reported.
And
then lastly here,
which is amazing.
This is awesome that this lab does this.
Yep.
So basically, while they have these microbes in a petri dish, they test both pharmaceutical and natural agents against it to see what works to kill it. So that way we're not guessing. We're not just pulling at straws thinking, I hope this antifungal works, I hope this herb works. We know which ones to use in order to be effective in the shortest amount of time.
Which, look at this one, resistant. Yeah.
And this person, fluconazole is the go-to antifungal, and it wouldn't have worked.
Right.
So if working with a doctor, which oftentimes we'll network with doctors, we'll collaborate and say, hey, this person's experiencing this, they have this overgrowth, these antibiotics, these antifungals work, they don't. Can you please help us with this client?
It's really good to know this information so you're not taking pharmaceuticals if you don't need to.
Exactly. Yeah.
Okay. Check this.
Last but not least, same thing we have here. This is against the
Yeast.
Candida albicans. The previous was against the Candida krusei. Here we see the Candida albicans is sensitive to the traditional antifungals. So that can be an effective way. We hear all about getting in and getting out. So getting in with the quickest, most effective method that will also allow us to restore optimal health faster. So it's not a quick fix. We're trying to be as effective as possible. And the way that we do that is by combining what might be a pharmaceutical, if we have a doctor that will help us, or a natural agent. Do that while supporting the underlying factors that allowed this issue to arise in the first place, and then restoring your gut microbiome, restoring the immune system so that your body can do what it's supposed to do.
And you feel so much better.
So much better.
We've all experienced this.
Oh,
and
man.
the gut really is the epicenter of your health.
Yes.
It's amazing. The energy, the clarity, the skin, the puffiness, the bloating.
It's huge. So if you are struggling, again, with irritable bowel syndrome, constipation, diarrhea, gas, bloating, that and or fatigue, weight issues, skin issues, brain fog, sleep problems, like I said, together, not always together. This is one of the tests that we can run to identify what your root factors are in order to implement a personalized plan.